Awesome. So good afternoon, everybody. Thanks for joining us for this edition of Ask Me Anything. We are sponsored by nobody, but we are run by UOAA's Young Ostomy Outreach Committee, which is chaired by me. Hi, my name is Molly Atwater. I am the Director of Young Ostomy Outreach for the United Ostomy Associations of America. We've been doing this series for a few months. So today's session is all about insurance and patient rights when it comes to living as an ostomate or helping someone in your life who is an ostomy patient. So we've got two awesome panelists today. We've got Amber, who is joining us from, is it University of Utah?
It is, yeah.
Yep, University of Utah as a case manager in a hospital. So if you are an ostomate or becoming one, more than likely you have met with someone like Amber, or you will in the near future. Mm-hmm. And we've also got Steve Vandevender, who is our new president-elect for UOAA, has lived as an ostomate and has worked a lot with the supply companies and as an advocate for others with ostomies. So he's an awesome resource to have here as well. So before we get started with some questions, I'm just going to ask both of them to introduce themselves, talk a little bit about how they ended up in a panel discussion on insurance and patient rights. And so I will go ahead and start with Amber. Why don't you take it away?
Hi, yeah. So I'm Amber. I'm a registered nurse. I work at the University of Utah Hospital, and I've been in case management for about 9 years now. So when I started as a bedside nurse, I've always loved nursing, but what I realized about case management is that it gave me an opportunity to help a lot more people. So instead of having, 2 to 4 patients a day, I would maybe have 25 patients that I could be involved with. So that was very appealing to me, and I was excited to go that route, and became a nurse educator for case management about 4 years ago. So I teach new case managers how to do the job and how to take care of patient needs when they leave the hospital. So I was asked by Bridge to, it was kind of funny how I got connected with this group, but through our clinical staff education department at the hospital, they reached out to me to see if I had some information, and I hope that I do. I hope I can bring something to the table for you today.
Awesome. Well, you definitely know much more about case management than me, and probably most of the people who will watch this video. So we're really excited to have you as a resource, and thanks for being here today, Amber.
Sure.
Awesome. Let's toss it over to Steve. Give us a little bit about who you are, why you're here, why you love ostomies, all that good stuff.
Well, my name is Steve Vandevender. I am talking to you from Bloomington, Illinois. I have been an ostomate for 25 years. And I'm old enough probably to be most of your grandfathers, so I'm honored to be in the young ostomate group today. I have spent 43 years in medical sales, and during many of that time I was in orthopedics, where I was on trauma call, 7 days a week, 24 hours a day. Developed ulcerative colitis, had an emergency colectomy, total colectomy. Like I said, 25 years ago, I actually had it on my 43rd birthday.
Wow.
So on my birthday, I say I have 2 birthdays. My regular birthday, and then it basically saved my life, because they told my wife 3 times while after post-surgery of the first one that I wasn't going to live. I had a bunch of post-operative complications. I had 3 more since then. I've been the president of the Peoria, Illinois chapter of the United Ostomy Association for over 20 years, and have always kind of been on the periphery of UOAA. I've spoken at the last 3 national conferences on leadership of ASGs, affiliated support groups. And when I finally retired from Convatec at the end of 20, the board asked me to be on the board. And so in 22, I was on the director at large. And now they've asked me to be president-elect. So basically be vice president for 2 years and then become president after that. So I like to think that I'm very much an advocate for ostomates, and I have kind of dealt with it from many different different areas, as both a patient, as a visitor. I do a lot of education. I teach at 4 or 5 different schools of nursing around Illinois and in Wisconsin. where I do a program what I call Ostomy 101, which is just the basics of ostomy so that they have a little bit of an idea, because as we all know that are ostomists, that a lot of nurses don't know much about ostomies. So it's a program that I started many years ago for Illinois State University, and it's grown from there. So I do a lot of public speaking from that standpoint. So that's a little bit about my story. Ostomy has always, so I jokingly say I used to have three hats: patient hat, obviously, and then my UOAA hat. And then when I worked for Comitech, working as a medical supply rep for an ostomy company. So it gave me the opportunity to speak to many ostomists and see people at home. I've seen more ostomies than I've ever thought I would have the opportunity to be able to do. But it's kind of scary thought when I would get brought in and people would say, if you can't get this to quit leaking, I just want to die. And as not a nurse, that was kind of a heavy burden, but it's allowed me to see a lot of different ostomies and be able to deal with it. And so become, I don't want to say proficient, because I don't think you're ever proficient at it, but give me a lot of tools in my belt to try to help people and that kind of thing. So today is going to be a little different. In fact, talking about insurance and other things from that standpoint.
Yeah, but you've so much experience. We are extremely fortunate to have you from all of the hats that you've worn over the years when it comes to ostomy care. So I feel like most people's ostomy journeys start in the hospital with surgery, either like immediately post-surgery because it's been an emergency, or in their colorectal surgeon's office, or starting there. So I'd like to start our conversation with patient rights and advocating for yourself starting in the hospital. So in terms of when you are a patient who has just had an ostomy or is about to undergo ostomy surgery, a little bit from Amber first, what does a case manager do to help patients like us navigate our experience within the hospital?
Yeah, that's a great question. So case management can help to connect patients while they're in the hospital with resources within. So I would think for a patient that is getting an ostomy for the first time, that when a case manager meets with you, having discussions about maybe, do you want a visit from a social worker? Do you want any kind of spiritual care? We have a wound nurse that will definitely see each patient and teach that person how to take care of their ostomy and how to do the wound care. And so those are things that you would do as a case manager within the hospital for a patient to make sure that they're getting the resources they need there. And then the case manager will talk to you about what it looks like outside of the hospital when you need to start ordering supplies and having follow-up in a wound ostomy clinic or with a GI doctor. So kind of helping you utilize your insurance for the best purpose. So getting those supplies, possibly home health if you need support at home with a nurse to come by and make sure that things are looking okay. Yeah, that's what you would expect from your case manager.
Yeah, that's great. And you mentioned insurance. A lot of people who end up with ostomy surgery, particularly ones who have not necessarily planned to have ostomy surgery, get really worried about the whole supplies and insurance issue. So how do you help patients navigate issues, or are there any issues with supplies?
Yeah, there are issues with getting supplies and getting the right supplies and enough of those supplies. So in the hospital, if a person doesn't have insurance, first of all, we'll make sure that there's a financial advocate in every hospital that can screen for Medicaid. So in some hospital systems, that would be the case manager that would screen for Medicaid or any kind of insurance coverage that could be had. So if you're a person without insurance, you should certainly be screened for to see if you qualify. If you have insurance, a lot of times, well, in my hospital system, it's the wound ostomy nurse, the specialized nurse that comes to see patients that will help to connect that person with supplies. So we'll look at the insurance, we'll see what medical supply companies that insurance works with, and then we get the final recommendations about what type of supplies are needed. And then the wound nurse or the home health nurse will help patients order those.
Okay, that's awesome.
Yeah.
That's awesome. Steve, have you ever had any issues with insurance in your supplies?
In my particular case, no. The insurance I had when I was working and when I first had all 4 of my surgeries was obviously employer provided. So in that respect, no. However, I do know, because of being on the other side, that you have to be careful that your employer does have what's called DME coverage, meaning durable medical equipment coverage, to where all ostomy appliances fall under the DME category. So you just need to make sure that your employer, when they're providing insurance, or if you have an option, you just want to make sure that you have the option that the DME aspect is going to be covered. And now that I'm on Medicare, it's actually, a little bit easier from that standpoint. The one thing that I will say that as a vendor that I used to find out is that people sometimes, because of HCPCS codes, I hope you all know what a HCPCS code is. That's the thing that governs by Medicare as to what category a particular product falls in. Sometimes the HCPCS code may only have a 20 or a 30 applied for that month or for that period of time. And so sometimes you have to really watch about the type of appliance you're using. If you have a chronic leak that you're having difficulties with and you're going through more than the normal amount, sometimes by switching types of barriers, meaning going from an extended wear to a daily wear, or in Comitech terms, it was stoma adhesive versus dura adhesive, sometimes you can get more one way or the other. So you kind of have to learn the HCPCS system a little bit. And I can only speak directly for Comitech, but in the back of the catalog, all the HCPCS codes for all of the different products are there. And so it's a way to kind of educate yourself as to what product you're using, and if you need more, a way to maybe stay within the system, but still move to a different product that has a HCPCS code with a higher value.
That's a great point, because I had never heard of the term HCPCS code. So my guess is a lot of patients out there are also unfamiliar with that. So that's a great
Well,
tip.
even if you're not on Medicare,
Yes.
the insurance companies go by the HCPCS codes.
Exactly.
So exactly. So that is really something that you really kind of need to know. And I mean, I used to work with some DME people to say, hey, I got a patient that maybe is on public aid and they are only allotted X amount, what can we do? And then I'd look at the HCPCS code and say, well, this particular patient isn't mobile, so maybe we don't need an extended wear barrier. We can go to more of a daily wear, and there your code, means they can have 45 in a month versus only 30 or whatever the case might be.
Yeah, that's a perfect resource. I know that in my experience with insurance, there have been a few times where, the DME has covered bags and wafers and that sort of thing. But in terms of deodorant or adhesive wipes or something like that, it hasn't necessarily fallen under the medical necessity clause of my insurance policy. So if you're looking at supplies and you're looking at what insurance would cover, keep that in mind in terms of accessories that may or may not be deemed medically necessary.
A prime example of that, because today the spray adhesive releasers are very, very, very popular. They work very, very well. However, they are not covered under Medicare and a lot of insurances, because wipes are much less expensive, and those are part of HCPCS codes. So that may be that's a product that I used to run into all the time. I use it myself, and I think it is a tremendous product, and so, but yet if I wasn't able to pay for it myself, I'd have to indeed, go to the wipes, which work, but they're just not quite as easy to work with as the spray adhesives. But that's a prime example, because alcohol-based is what's been around for years and years. That's what the HCPCS codes are based on. So the new silicone, no sting type stuff is more, that they want to obviously spend as little money as possible. So so there's a possibility you may have to pay for those out of your own pocket.
Good point. So Amber, when it comes to supplies, when I was in the hospital, we had a case manager who came by with, I believe it was Hollister's Secure Start package, which was their onboarding for new ostomy patients. Is that something that case managers typically handle, the supply ordering process, or is that something that we would deal with outside of the hospital?
It may be your case manager that does that. Depending on the hospital system, it would be the case manager, or it might be the specialized wound nurse within the hospital that would set you up with the right supplies and give you some from our hospital supply. And then show you how to order more of those. Or if you're a person who needs extra support at home and needs a home health nurse, then the case manager would set up home health for you, and the nurse that comes to your home would really secure that for you and help you to know where to go to get your supplies.
Okay.
Yeah, so it could be any number of nurses within the system, but a case manager would be able to tell you who could do that for you if
Okay.
they aren't the ones to do it.
Yes.
Yeah.
So if they aren't necessarily the ones who would make that happen, they should know who they need to get in touch with to make it
Yes.
a reality.
It's important to know that not every hospital has a wound ostomy nurse or even a nurse that is kind of their person. So, because I mean, I used to call on many hospitals that did not have that. So there, in some cases, it'd just be a surgical nurse that might be the one that'd be involved in it, or the case manager would get more involved with that aspect of it. So it just kind of all depends on the size of the hospital and what services are available.
Yeah.
And then that kind of segues well into my next question, which was going to be how is the best way to advocate for yourself in the hospital system, where we're obviously in a pretty vulnerable position in terms of we're just out of surgery. We have a lot of questions. There's a lot of unknowns. Sometimes we're not necessarily aware of what care we are or what care we should be getting and whether or not we are getting that care. So what would, in your opinion, be the best way to make sure that all your needs are being met from an ostomy perspective or just as a general patient perspective?
Yeah, I'll start with that. So I think just being the squeaky wheel and not being afraid to ask any question that comes to your mind. If you have that intuition that maybe something isn't quite right, or maybe there's more information that you need or want, don't ever be afraid to ask for that. And, just saying to your nurse, can I speak to case management? You can speak to case management whenever you need to, or even saying, can I speak to a provider? Like voicing your concerns, I think is really important, and not being afraid to do that. That would be where I would say to start.
That's great. Do you have any thoughts on that, Steve?
Well, two things. I mean, there's kind of two different scenarios. You've got the person that is emergent. I mean, whether it be from a car accident or from some reason to why they had surgery immediately that maybe didn't know anything about ostomy. That obviously is a very difficult situation because, you're dealing with something brand new. I mean, I had no idea what an ostomy was when the surgeon approached me and said, there's a good chance, you're going to have an ostomy. I didn't know what it was. Now, again, that's 25 years ago. On the other hand, then those of you that have been through the situation of maybe ulcerative colitis or Crohn's disease or other diseases where it's been a long time, many times of going to the doctor and that kind of stuff, where you've had the opportunity to learn, that makes it a little bit better. I would say you've got to just try to become as knowledgeable as possible. And I say that for two reasons. I, not too terribly long ago, got it dehydrated. Even though I know about dehydration, I know how I can't let that happen, but I got food poisoning. And within a period of about 12 hours, I got dehydrated so bad that my hands were cramping, my jaws were cramping. And I mean, I knew what was going on, but I went to the emergency room. And when the emergency room doctor came in, and I, of course, already told the nurse I have an ostomy, he comes in and and I have an ileostomy. And the first thing he says, oh, that's urine, right? And I thought my wife was going to I was going to pull my wife down off the ceiling because she was so mad. And then another example, we just recently had one of our board members who just recently went into the hospital who irrigates, and nobody had any idea what irrigation meant. And so, I mean, that's why I said there's two different scenarios. If it's emergent and that kind of thing, it's really hard. But yet, if on the other side, you need to learn as much about it in the squeaky wheel. I couldn't agree more. You've got to speak up and be your own patient advocate. And I mean, yes, the UOAA has our Bill of Rights. And so if you're, that's one of the things that we have and we promote to let you know what your rights are. But if you're in that situation where it's emergent, it's in a whole different story. So maybe have a family member try to reach out to UOAA. Try to learn as much as you can, as quickly as you can. And hopefully you're in a hospital that knows more about what an ostomy is. So.
Yep, I was literally just pulling up UOAA's advocacy page, and we've done a really nice job. Janine Gleba, who's our director of advocacy for the organization, she's worked really hard to create a Bill of Rights for all ostomy patients, where you can kind of present that to your care team. And these are all things that you as a patient are worthy of care. You're worthy of all of the treatment of a typical hospital patient. So if you're not having a great experience, I definitely encourage going to the UOAA website and be in that squeaky wheel. We saw that in the media over the last month or so with Matthew Perry, who talked about how he did not have a great experience with his ostomy. And I think we all kind of wish that he'd reached out to UOAA and gotten the patient bill of rights and advocated for the care that he deserved. So ostomies are tricky. There is definitely an art to them. There are times when they leak and you don't really know why, and all the professionals aren't really quite sure either. But that doesn't mean that you are not worthy of having a good ostomy experience and a good hospital experience or anything like that. Yeah, Amber?
Yeah, sorry, I wanted to add this too. Any hospital that receives funding from Medicare or Medicaid services, CMS, has to go by the conditions of participation for discharge planning. And part of that is that we do have to include your caregivers in your discharge plan and in your hospital care. So that is a patient right that, it's not just the patient that needs to hear all the information, it's their caregivers and the people that are going to help to support them. Statistically, patients don't remember a lot of the teaching that they get in the hospital, and that's just sort of across the board. That's just totally normal. So asking for things in writing is really important also, because then you can refer back to that when you're out of the hospital and you're trying to remember conversations. That's going to be hard. So written information would be something you should ask for too.
Yeah, that's a really great point. I've definitely, when either my husband or my mom have typically been my advocates in the hospital, but when they've stepped out of the room or anything like that and a provider has come by, I've asked if I could record them, just because in terms of anesthesia and all that sort of things, writing probably isn't going to go super well. But if I have the recording, then I can play it back. My mom can hear it, my husband can hear it, and we can hear exactly what was going back and forth within the room when the provider was there. So that's a really good point. Yeah, Steve?
There's a key piece of information on this Matthew Perry thing that I think goes unnoticed, because he admits that he had 14 surgeries. Well, I've had 4, and I know what my stomach looks like as a result of 4 major surgeries. So I don't know what his 14 surgeries were, but I also know, because I've seen so many patients, that I would say, unless he had good nursing care, there's a good chance he's going to have leakage problems because of his anatomy and because of all those scars. So I just, everybody kind of bypasses that a little bit and they're talking, because he's so negative about what transpired. But boy, there's a classic case where a mundostomy nurse is just worth their weight in gold. And unfortunately, it sounds like he didn't get that kind of care. And I don't know, but it doesn't sound that way. But anyway, 14 surgeries, sure, that set a red light in my head, because I was like, no wonder he had some problems.
Exactly. When you've got all that scar tissue and all the nooks and crannies and all that sort of thing, and more than likely it's right around that stoma area. But again, to your point, to my point, like, even if you had 14 surgeries, you still deserve to have a good
absolutely
experience, even if it's
more so
challenging, even more so. Yeah, absolutely.
Exactly, because they've been through all that. They certainly need more care and that kind of stuff. So
exactly. So be in that squeaky wheel, getting the care you need, getting the care you deserve. That's a really great point. We actually got a question in our chat, wondering if either of you have experience or knowledge regarding health insurance for disability due to an ostomy, or health insurance due to disability for just in general.
I know in the hospital, for us, when we're looking at a patient that might qualify for disability insurance, we have to have our providers, if our providers feel like that person will be disabled for a year or more based on their medical condition, then we can push for a disability Medicaid type of and so I'm not an expert in this at all. And my job role doesn't include the actual screening of patients for Medicaid. We coordinate for that, but we don't do that part of it. But that's been my experience, that the condition has to be something that prevents you from working for 12 months or more.
Okay, that's great information. And I know that.
And there's no question. I know that Medicaid does cover ostomy appliances. So that I'm positive of. And then if it's a Medicare disability program, I'm on Medicare and it obviously covers it from that standpoint.
Mhm.
So I would think, I can't again say definitively, but I certainly would think that it should be able to be covered as long as you meet the right criteria and stuff. So.
Awesome. And then kind of in that realm, we've talked about insurance and supplies. What happens when you get home from the hospital and things kind of take a turn and all of a sudden you are without supplies, you've gone through all of your supplies that insurance has allowed you for the month. What happens then? Amber, have you ever faced that experience?
Not that specifically, because I don't follow patients once they leave the hospital. I'm sure that is an occurrence, and I had a couple of thoughts about that. I understand that some of the ostomy supply companies will provide free samples, so maybe asking for some free samples, reaching out to your GI doctor or your wound care clinic that you follow up in to see if they have any samples that they can give you would be something I thought of. Some clinics have care managers, and I don't know, this is not certainly across the board, but care managers can help patients in the outpatient world to be connected to any kind of charity or community resources or programs or grants having to do with ostomy or any of their medical problems. So kind of connecting them to resources in the outpatient world. So asking the clinic that you go to if there are care managers that can work with you and help you to be connected to help with those kinds of problems.
That's a great point. Yes.
This is something, yes, I've had to deal with this from a couple different angles. As a Comitech sales rep, I got calls from hospitals and from nurses all the time, talking about somebody who had no insurance. So Amber's correct in a couple of respects, then the fact that the manufacturers will provide some. They have their starter kit programs, Hollister calls it their secure start, where they'll give you just a handful of things to be able to help get you going. And then I know Comitech has a program where they'll provide free supplies for worth a 90-day supply, but it's a one-time only deal. And if you go through that 90-day supplies in 10 days, there's no more after that. But that program was really designed to be able to work with the local hospital or the local case manager to try to help get you on Medicaid and or Medicare or some type of insurance. So that's kind of one avenue. Another avenue for if you've run out or you still don't have any is the local ASGs, affiliated support groups. You can call UOAA office or go on ostomy.org, which is the website for UOAA. And there is a list of all the affiliated support groups around the country. My particular group, we have a closet in our meeting room where we meet, where people give us supplies. Either they passed away or maybe been reconnected, and so they don't need the supplies anymore. So there are times where we can give supplies out from that. I would probably not call my doctor because in most cases, the doctor probably doesn't have any because that's not kind of their realm. So I would try ASGs. And then there are also some companies around the country, Ostomy 211, Kindred Box, and then there's a company down out of Florida called Osteo that will provide supplies at a very minimal cost to be able to help from that standpoint. So, and then I guess the last but not least, but the most expensive route is to purchase them outright if you can, through Amazon. I mean, that's kind of the last resort from that standpoint, or possibly go to a local DME that will, you can pay cash for. But before you get to that point, because you're paying retail, before you get to that point, I would try some of those other avenues first.
Yeah, and I know there are a lot of ostomates out there who have good insurance coverage, and maybe like I'm in this case where my insurance will cover 20 wafers and 20 bags a month. I only go through about 9 to 12 bags a month, so I've got quite a stockpile. And I try to donate to Friends of Ostomy Worldwide. I try to donate to Kindred Box. I try to donate to places where they can be connected with other insurance limited resources for others to get them. And then also worth mentioning would be either through your ASG or a local ostomy either Facebook group or other social media place. Sometimes if you write like a little note to say, hey, I'm running really low on supplies, it's been a crazy leakage month, does anybody have XYZ supply from Coloplast? I've gotten a couple of bags from family friends where they just had a couple extra, and especially in those first few months where your stoma is changing size and you're not quite sure what product you're going to need, and all of a sudden you thought that you had the Cinderella bag where it was absolutely, the shoe fit perfectly, and then all of a sudden it doesn't. Definitely having those resources to say, hey, we can do a tit for tat when I get it back next month from insurance. Happy to give you a couple bags, but having some people in your corner who you'd be able to do a little swap with is definitely helpful as well. Bridge, who's an ostomy on the call, and she also works in the hospital, has mentioned that the ostomy clinic, outpatient clinics of the ostomy nurses can also provide emergency supplies if you reach out to them, which is an awesome resource.
I agree with that 100%, only they're probably not going to be able to do it long term.
Yeah.
I mean, they're going to be certainly a short-term fix, maybe 1 or 2 or 3. And again, maybe not necessarily what you particularly need. Whereas an ASG might be able to provide more. I mean, it kind of ebbs and flows. We send when they overflow in our closet, then we send to FOW as well, Friends of Ostomy Worldwide as well. So somehow it depends on how much is around at that point in time. So.
Yep, and I feel like the path you take to find replacement supplies depends on, is this a one-time thing? Is this an I don't have insurance thing? Is this it kind of depends on the time range that you're looking for additional supplies for. So Amber, I'm trying to think of any other hospital-y sort of ostomy questions for you. Do you deal with a lot of ostomy patients in your role?
We do have a lot of them, yeah, depending on what unit of the hospital the care managers are on or case managers are on. Our surgical units do see a lot of them.
Mm-hmm.
Yeah, and then we have some dedicated, sorry, I got a friend here. We do have some dedicated case managers to the surgical units or medicine units. Yeah, so we do see a lot of them,
okay,
for sure.
That's great. Do you, I'm trying to think of how to phrase this. Do you get brought in for either nurse care or anything like that? Because I know that I've experienced some nurses who have a stigma about ostomies, and I've known a couple of patients who they've interacted with nurses who have not necessarily been tremendously positive about them, and so they've tried to bring that up to case managers. Have you ever had to deal with an experience like that?
I haven't had to deal with an experience. I haven't heard of, I could imagine that happening though. I haven't had to deal with that, but I think pulling a case manager in, if you have concerns like that, are important, because we can talk to the unit manager, we can talk to the staff. They can find a more appropriate nurse maybe to have that, to have that person the next day or the next shift, or even swap nurses if it's really a problem. So yeah, never be afraid to bring that up. If you're not comfortable with your caregivers, changes need to be made with that. Mm-hmm. I'm sad to hear that. That wasn't something I considered at all, but yeah. Mm-hmm.
And Steve, it definitely sounded like your question of urostomy was from your provider. It wasn't not I don't know what the word is. The provider who assumed that your bag was urine rather than stool.
Oh, that was the emergency room doctor.
Yeah. How did you handle that? Because I know that there are some ostomates who that's their worst nightmare, where they have to kind of go up to bat for themselves.
I said, no, sorry, it's fecal. It is not urine, and then of course I went on a little spiel about UOAA and my involvement having it for a long time and that kind of thing. So,
Mhm.
but I mean, it's just something that happens. I'm sure that there's people out there that have had similar situations. I mean, in all your health history, Molly, I'm sure it's happened to you to a certain degree as well. So, and as I see a bridge as a picture of bridge, you look very familiar. Have you been to a UOA conference? Because you look very familiar.
Yeah, I have. And actually, is it okay if I add something, Molly?
Absolutely.
I'm just thinking about this a lot because this is something, actually, Amber, this is what Becky, the nurse educator, and I have been working on, is sort of addressing stigma around ostomies and trying to think about ways that we can help patients feel more comfortable. From my perspective, that looks like inside of the hospital, but also like from my sort of clinical perspective, but also um, how we can help patients sort of advocate for themselves when they feel like there's maybe a gap in care because of that stigma. And something that I've talked about with some of the nursing teams, especially in our inpatient medical surgical units, is like, what are the ways that patients can bring up that concern that don't like, what are the ways that patients can sort of address that without it feeling like the staff is being attacked for not understanding something about the ostomy? Because I think what comes up a lot is that most bedside nurses are not specially trained in ostomies whatsoever. And so they come into that space, like, obviously really wanting to care for their patients and do a good job, but not always knowing how best to handle ostomy issues. Like, if somebody's having a lot of leaks, that's not something that the bedside nurse is usually going to know how to help with. So, or at least I should say their sort of troubleshooting skills are limited to what training people get in nursing school often, which is pretty limited for ostomies. So all of this is to say that something that has come up a few times that I just want to voice here is that nurses feel like if patients say, like, address the concerns they're having by saying something along the lines of, like, I feel like maybe people are afraid to try and, touch the ostomy, or people are afraid to try and work on this problem, or I feel like there's some judgment about the ostomy, or like anything like that. When patients can sort of address those concerns and bring up the fact that they feel like their care is maybe suboptimal because of that stigma or judgment or whatever it is, that the teams like will totally address that and want to talk about that if they know that that's something that someone's feeling. So I really appreciated what Amber said about, like, talk to the case manager if you feel like the care is not what it should be, and if you feel like there's stigma. And that's something that, like, I mean, at least for me and at the University of Utah, something that we're working on is improving the sort of stigma and culture around ostomies. But unfortunately, a lot of that has to come from patients in their individual settings and wherever they are. I wish it was something where we could just, like, educate everybody really quickly and I could go around and, like, give my ostomy spiel to everyone. Um, but that's something that patients have to do all the time for a lot of different conditions and a lot of different disabilities and medical devices. So that being said, I just really encourage patients to advocate for themselves by just describing how they're feeling and describing what kinds of concerns they have about stigma and about um, judgment, so that folks can think about that.
Thank you so much for chiming in. We're our honorary third panelist. I love everything you said.
It's also not just hospitals. I mean, I used to deal with all kinds of home health nurses, and we would call and in service at home health agencies. And one of the questions I used to at the beginning started would say, well, what do you guys know about ostomies? And I always got the same answer: they leak. And I'll say, well, they all don't leak. Oh, yes, they do. And I'll say, no, they don't all leak, but yet they can be a problem. So I hate the term stigma about an ostomy, but there's no question that there is some not so good feelings, about what an ostomy means and stuff. But and that's where you've got to advocate for yourself and try to learn as much as you can, as fast as you can.
Mhm.
I have always been very open about it. I mean, from day one, I looked at it as it saved my life, and so I'm going to go out there and try to help educate more people about it. And that's 25 years later, I'm still doing that. But I think that's what we all have to do as ostomates, to be able to try to help educate people and become as knowledgeable as we can on our own, so that we can come across as being credible when we do talk about things. So.
Yeah, that's a really great point, Steve. We have to be our own advocates, even if we're in a medical setting and we feel like we're in a hospital, so they should know about an ostomy. More than likely, I've had nurses before where the only time they've ever seen an ostomy was in a textbook. And so I've kind of made it my mission that whenever I am in a hospital, and I am with it enough that I'm doing my own bag changes or anything like that, I will basically tell my nurse, hey, I'm about to do a bag change in the next hour. If you want to gather up any other nurses on the hall who have never seen an ostomy, who haven't really done a bag change, literally anybody you want to bring in who would like an experience where, like, I'm comfortable with my ostomy, it's not super leaky. This is a great beginning level step into the realm of ostomies. Happy to answer any questions. If you want to poke it, you can poke it. Like, just like the easy, have this experience before you have a patient who's really uncomfortable with their ostomy and isn't necessarily ready to be their own advocate. Because we all need to be our own advocate, but sometimes in hospitals, especially if this was not part of your plan, it's a little hard. So if you are in a position where you are pretty confident in your ostomy, think about it as a way to give back to your fellow ostomates, to kind of educate the nurses, providers, anybody who is willing to listen, and kind of squash that stigma a little bit.
Molly, I love that. That's great. That you do that you try to pull in nurses and educate. That's so helpful.
Yeah, and I give them wafers if they want to practice cutting wafers. I get a lot of questions about, like, do you feel it if I touch it? It's all the things that we learned as ostomates because it's our body and we had to. And there are so many nurses where it may not be their favorite thing to do, but they really, as Bridge said, they really want to take care of their patients in whatever way that they can. And so if that's becoming more familiar with ostomies and helping somebody troubleshoot a leak one day, I hope that they think back and be like, yeah, that Molly girl who let me poke her stoma, like that was really helpful. So just trying to give back to the community at large. It's really great through doing your own advocacy, and it'll help some others in there as well.
That is exactly why I teach the Ostomy 101 classes that I do. And I have had feedback. I've literally seen nurses that were out in the field working at hospitals years later that would come back to me and say, hey, I remember you. But part of the reason they remember is because I was an ostomy. I mean, I get feedback every time I give a talk, and I say, I'm not asking for accolades. I just want to know what did you like? What could I do better? And they all say the fact that you were an ostomy and are telling your story and interchanging not only what you're telling us about different types and all that kind of thing, but how it affects you and what you like and what you've learned and all that kind of thing makes a huge difference. So,
and I think that kind of goes along with so many nurses and practitioners want to take care of their patients, and yes, they can care for an ostomate beautifully, but unless you've lived with one, you can't really understand all the little quirks that go along with living as an ostomate. So sharing those experiences with providers and nurses, I think, goes a long way in helping them see the patient as a full person outside of their ostomy as well.
So I've only had my ostomy since 2020, and from my experience, often when I'm encountering a healthcare professional, the first question they ask me once I reveal that I have an ostomy is it reversible? And it kind of rubs me off the wrong way, because it's like this negative connotation, like that's something that you definitely don't want to have if you don't have to. And even in my case, mine is technically reversible because I do have a loop ileostomy, but I've chosen to keep it permanently because of what it has done for my life and given me my life back, and all the complications or possibilities that could happen if I tried to reverse it. So, that's something that I've often encountered, and I, make the point of saying, yeah, I can reverse it, but I'm choosing to keep it permanently because, this has changed my life and it saved my life. And I think that's something important for healthcare professionals to realize, that, it isn't a death sentence. And yes, people may not appreciate it at the beginning. It was an emergency, so on and so forth. But over time, and for a lot of ostomates, they suffered a long time before getting it, and it was a positive change. It's something that helped them. And I think that's something that not all healthcare providers, whether it's a doctor or a nurse, they understand or realize. And I think it's important as patients for us to voice that, so that it can, help to break down that stigma against ostomies in general.
I love that point, Ayana. That was the first time that I ever had a little bit of friction with a provider, was when I said something about, yep, I ended up with an ileostomy, and their first response was, "I'm so sorry, when are you having it reversed?" And for me, that was like, wow, I kind of hoped that as a medical provider, you would see that this helped give me my life back. This was a positive change, all that sort of thing. And so I kind of called them out and was like, nope, this one is permanent because I chose for it to be, and my life is so much better, all that sort of stuff. But it definitely made me pause and made me ask myself, wow, if I wasn't as confident in my ostomy, how would that comment have made me feel? How would that have changed my perspective on my ostomy? And my hope is that by addressing that, and I'm so glad that you voiced that as well in your experience, was by addressing that, maybe the provider wouldn't say the same thing to another future ostomate. And that goes into our patient rights thing. Like, we deserve to, we don't need pity. We don't need I'm sorry's. We just need to be supported where we are. Some of us are so excited that we have our ostomies. Some of us aren't super thrilled with it, but we deserve to be treated as patients and people who are just on this journey doing our thing, and kind of from an objective, not a subjective point. So thank you so much for bringing that up. That was really, really crucial. Steve, as an ostomate, have you ever had the "I'm so sorry"?
No, I can't say that I have. I think because I've always been so positive, because it saved my life. So no, I've never had that. But one of the things that came to my mind while was the last speaker was speaking, as a support group leader for 20 years and having all kinds of new people come to my support groups, I have heard, I cannot tell you how many times, where somebody will say, my doctor didn't tell me this, or my doctor didn't tell me that, or my doctor is no help with my leak, or no, my doctor's no help with my skin irritation. You guys got to remember that the surgeon does the cutting. The surgeon works with what's going on inside your body. And many of them, not all, but many of them leave the other part of it, the outside part, to the nurses. And so a lot of them don't know but their expertise is what's going on inside the body. And I always tell people, we got to remember, it's the practice of medicine, not the exact science of medicine. And so many times they'll say, well, he didn't tell me this, but then something happened. So all my point is that you have to be your own advocate, which is in essence what we're all saying. But you've got to learn as much as you can, because just because they've got MD behind their name doesn't necessarily know that they mean everything. And I've dealt with surgeons in orthopedics and in wound care and general surgeons and cardiothoracic, and boy, they got egos. And so they think they know everything, but yet when it comes to what's on the outside of the body, they're not. Some of them, there are some that aren't that way, but that is something that they're not so much concerned about. So you got to try to find that right person to be able to help you. Mm-hmm. things like this. I mean, this is part of why Molly's doing this. That's why the education, that's why we do these kind of things, in order to try to spread the word, to give more people the idea of things that they can do to help themselves.
Mhm. And that's why, Amber, even though you don't necessarily follow patients all the way through once they go home, thank you for helping us build a solid foundation for going home, because without case managers trying to help us navigate insurance and helping us navigate all of the care that we're receiving in the hospital, I feel like that sets us up. That definitely determines how well we do once we get home and we're without all the monitors and the beeping and the lack of sleep and all that good stuff that you experience in the hospital. But no, you and your fellow case managers are so crucial to giving us more confidence as we head home and have to become our own advocates outside of the hospital, because that it translates into work, it translates into transportation, it translates into dealing with the TSA, like all of those places where you all of a sudden need to kind of stand up for yourself and say, here's what I need, here's why, this is my right. So thank you for doing all you do to make sure that we have as good as an experience as possible.
Thank you. Thanks for saying that.
Absolutely. Well, we are running lower on time, so if there's any other questions, either from our peanut gallery or from our speakers of each other, happy to open the floor to that. Not everybody all at once.
I will say, in my 25 years of having an ostomy, the great majority of ostoments that I have run into are always more than willing to try to help somebody else. Yes, there are some that are still mad at the world because they've got this, stoma sticking on their stomach and some of the negative connotations. But for the most part, most of us all feel like the ostomy has saved our life. And I know, the logo for UOAA is a lifesaver, and I know that's a little hokey, but still it's very, very true. And so I really believe that the ostomy community, and I'm sure it's like this with diabetes and some of the other different types of things like that, but most ostoments are more than willing to try to help somebody. And I mean, we get a new person coming to my support group, and everybody is ready to answer questions and that kind of thing. So my point is that, boy, getting involved with the community, whether it be by Zoom, whether it be by Skype, whatever, if you go to a support group, being involved with UOAA, I mean, that's what we're always trying to try new methods of being able to get messages out there. YouTube has got some great information on it. There's also some wackies out there too, but there's really some good stuff. The manufacturers have got good information. I've been surprised in 25 years how most everybody's willing to help. And that's how you learn. The Phoenix magazine is another way. I've learned so much by reading the Phoenix magazine. So, and I actually at one point got Comitech to supply a Phoenix magazine for every sales rep they had. Wow. Because it gave them a better idea as to what our lives are like and that kind of thing. So, it's just something I think is important, that if you're new to the ostomy world, you just got your ostomy, there's all kinds of people out there that are willing to help you. And I
always tell people, the ostomy community is not a club that I ever wanted to be a member of. But now that I'm in it, like, I never want to lose that membership, because everyone is just so genuinely helpful and caring and empathetic, and they get it. Even if you have the best support system in the world, there's just something about knowing that person that you met at the ostomy conference, like, you can talk about some really gross stuff and they'll be like, yep, that I did that on Thursday. So it's an incredible community. There are incredible resources for anything from doing patient right advocacy stuff, asking insurance questions, troubleshooting leaks, everything under the sun when it comes to ostomies. We've got a really great community. So
Amber, here's one I bet you've never heard, but I know that Molly has. We are unique members of what's called the 5P Club. People who pee and poop in plastic pouches.
I've not heard that.
I have not heard that one either. I like that.
You never heard that, Molly?
No.
Holy cow, that's an oldie but goodie. But
no, I'm only 5 years in, so I got much more to learn.
As an ostomy visitor, I've used that a whole bunch of times. My wife doesn't like it, but I try to lighten the mood by, you're a proud member now of the 5P Club. What's that mean? People who pee and poop in plastic pouches. So.
My husband and I say we are a very poop positive household. So it's a fun way to be. We always joke that when we start having kids, like that baby's going to have to do some major damage in a diaper to beat whatever leaks I've had going on. So, but yeah, thank you guys so much for joining us for this conversation. I've learned a ton. I'm going to check out some HCPCS codes, and just thank you for your perspectives on dealing with this from as an ostomy patient, as a case manager. Both of you are tremendous resources for patients of all types, but particularly ostomies, the ones near and dear to my heart. So thank you guys so much for having this conversation, and I'm really looking forward to publishing it so that the rest of the world can see and learn. Before we wrap up, just wanted to mention that this is going to be our last AMA for the 2022 calendar year. December, as you may know, is the holiday season and things get a little bit busy. So we will not be having an Ask Me Anything panel discussion. Instead, on December 17th at 2 p.m., we will host just an open house 1 hour Zoom call where you can come and hang out and chat about your holidays and anything ostomy related. We'll just do an open house that way, but we'll be right back at it in January with a conversation with some caregivers and loved ones who help others with their ostomies. But that's all I got for this brisk November day. I'm gonna go ahead and sign off, say one more thank you to Steve and Amber, and Bridge and Ayana for popping in as well with their insights, which are super valuable. But have a very happy Thanksgiving. Have a happy rest of your holiday season if I do not see any faces before then. And stay tuned for all the UOAA stuff that's coming in 2023. So thanks everybody for joining. Have a great afternoon.
Thanks, Molly.